TMS in terms of side effects is generally very well tolerated, which is actually one of the nice appeals about it is, a lot of medicines, especially after you failed the first and second line medications, beyond that, they really start to have a lot of side effects in terms of weight gain and sedation and other things. But the big advantage of TMS is there's really very little side effects. Headache may be the most common thing that people experience, but that's usually just during the period of time they're sitting in the TMS chair. They don't tend to have a headache ongoing for days or anything. It's just during that window of time. There are some other very rare side effects, but it's getting into the area of 1 in hundreds of thousands sorts of things. But again, that's part of the consultation. We'll talk to you about what are those 1 in 100,000 sorts of things, and what is my risk of that.
Dr. Becker described the headache. A lot of my patients in the office will describe it as more of kind of a pain or kind of a knocking sensation over the treatment area. I'm knocking on the right, but it's actually on the left is where the majority of the treatments are. So it'll feel like a knocking. Some people describe it as almost like a little hammer or a woodpecker, mm-hmm. right? A little something kind of poking at them during it. The nice thing that we spend a lot of time doing during the first initial appointment is actually trying to make it comfortable. So there are lots of things that you can do so it's the discomfort is tolerable. And generally by, I would say, the third, fourth, fifth session, people don't even describe discomfort. The interesting thing that the body does is when you're feeling this discomfort, and the reason the discomfort happens is because you're having these magnetic pulses that pass through the muscle, and the muscle's contracting underneath, so it feels like a little knocking. But the body actually starts putting a little bit of endogenous opioid there. And some patients actually come in through the, by the time they're coming in the waiting room, they'll say, I think my head feels a little numb today before we even start. It's because the body's actually kind of taking care of that area, kind of putting a little internal painkiller. And then when they come to get in the treatment, it's just not as uncomfortable. So
yeah, and I will say in 10 years of doing this, 10 plus years, mm-hmm. I can probably count on one hand the number of patients that have not completed a course due to side effect.
I can think of maybe one that just didn't complete a course over that time.